Our 2021 Global Shifts Colloquium has brought together academics, policymakers, and leaders from all over the world for days of discussion on how COVID-19 has affected global mobility and how to mitigate these consequences. To introduce today's keynote conversation, it's my honor to welcome the president of the University of Pennsylvania, Amy Gutmann. President Gutmann, if you could please join us on the screen. Amy Gutmann is Penn's 8th president, serving since 2004. She's an internationally renowned leader in higher education, a prominent advocate for increased access to higher education, for innovation based on interdisciplinary collaboration, and for the transformative impact of universities locally, nationally, and globally. She's also the incredible leader that imagined Perry Worldhouse in the first place, and we are very grateful to her for her leadership, and also she's my boss. So President Gutmann, over to you.
Thank you so much, Mike, and thanks to all of the Perry Worldhouse team for bringing us together around this truly urgent and important global issue. We're also deeply grateful to Richard Perry, who I hear is tuning in with us, for helping lead Penn's global engagement through Perry Worldhouse. Welcome, everyone. So for some people, it's easy to cross a national border. Perhaps for many people who are listening in today, easy to cross a national border. However, for many people, whenever nationalism rises or war want and pandemics descend, borders quickly become barriers. What Penn Professor Beth Simmons calls border orientation is a spatial way and a special way of understanding the hardening and thickening of international borders. Life and death, plenty and paucity, peace and violence, which side of the border you find yourself on can change everything, everything. It did for me. My father fled Nazi Germany, and he helped his whole family do the same by crossing borders that were, at that time, still barely crossable. I exist today because Kurt Gutmann, with equal parts great luck and great courage, made it to the right side of first one border, then another, and finally here to the States. But many, too many, are not so fortunate. Unlike the current coronavirus, the current global refugee crisis is not novel. This high-stakes challenge grows only more so with the pandemic. To help us understand the big picture better, I am both pleased and proud to introduce today's keynote speaker and Penn's honored guest. He recently addressed a press conference in Ethiopia about the conflict unfolding in the Tigray region of that country. After visiting a refugee camp there, he reported that the humanitarian situation is extremely grave. Pitching his remarks to the ears of the powerful, he implored, intervene for civilians, lend access to the UN, and he voiced the timeless refrain of refugees everywhere. We are frightened, we want to go home. As the 11th United Nations High Commissioner for Refugees, he is devoted to international cooperation and aiding the displaced. He heads one of the world's largest humanitarian organizations spanning 135 countries. For several decades prior, he served in a variety of roles with the UN and various NGOs, intervening for humanitarian needs in the Middle East, Africa, and Asia. Few know the refugees' plight or the promise of their rescue better than he does. I am truly honored to welcome UN High Commissioner for Refugees, Filippo Grandi. Welcome. Penn is really happy to have you with us, High Commissioner. I am also honored and pleased to welcome an award-winning international correspondent, scholar, and teacher, and member of the Council of Foreign Relations. Reporting on the Middle East and US refugee resettlement and immigration, she features regularly on NPR's Morning Edition, All Things Considered, and Weekend Edition. I know her voice incredibly well, and you will now be able to see her on the screen. The Ferris Professor of Journalism in Residence at Princeton, she's the author of 2 books on upheaval and uprisings in the Middle East. On a recent Morning Edition, she weighed in on President Biden's pledge to allow more refugees into the US. She pointed to a Pew study showing that a majority of Americans now support taking in refugees. Her following insight was startling and hopeful. By bringing so much attention to the issue over the past 4 years, the previous administration may actually and quite inadvertently increased American support for the plight of refugees. Let us hope that is and remains the case. Silver linings, indeed. I am honored and delighted to welcome Deborah Amos. Thank you both so much. And with that, I want to turn it over to you, Deb.
Thank you. Thank you, President Gutmann. This is such a great gathering because I think that this issue has been crucial for the last 4 years and will be crucial for the next 4 years. So I'm going to open the floor to His Excellency for opening remarks, and then we will come back for a conversation.
Thank you very much, Deborah. And thank you very much, President Gutmann, Professor Horowitz. I'm extremely honored to be here, virtually here at Perry World House and at the University of Pennsylvania. I would much prefer to be there in person, but such are the times, and it's a great privilege for me to be able at least to share some thoughts with all of you. And let me start by stating the obvious, that the COVID-19 pandemic has affected, continues to affect, and will continue to affect us all. But very clearly, this sentence has been used many times, we are all somehow in the same sea, but we are on very different boats sailing on this COVID-19 sea. Very obviously, the most vulnerable people among us in the world have suffered most, have been more impacted by the pandemic. And among them are the people that my organization, the United Nations High Commissioner for Refugees, UNHCR, deals with. Refugees, asylum seekers, what we call internally displaced people, refugees in their own countries, stateless people. All of these people have been particularly impacted in ways that I will try to explain. And in order to better understand this, I think it would be useful to give, for those who are less familiar, a little bit of background, of global context. We estimate that in the world, refugees and displaced people, forced displacement affects about 80 million people. These are figures that my organization puts out once a year in June, on World Refugee Day, the 20th of June. So I expect that since we are close to the next timeline, June 2021, this figure is likely to be even higher. Nearly 80 million was the figure of last year. Refugees flee from a variety of problems, of crises. They run from war. Think of Yemen, think of Afghanistan, think of less known situations like Mozambique or countries in West Africa like Burkina Faso. Refugees flee from different types of persecution, discrimination, or violence. Think of the Rohingya refugees coming from Myanmar and largely in Bangladesh. Think of many, an increasing number of LGBTI individuals fleeing discrimination based on sexual orientation in their country. Think of people fleeing a deadly mix of gang and often domestic violence in Central America, many of whom are heading your way in the United States. People flee places where violence is pervasive, is rampant, and there is no protection offered by states. It's the loss of one state's protection that somehow qualifies a person to become a refugee, especially if he or she crosses a border. And remember, another important context point, that despite what we often hear, watch, and read, and especially hear from some politicians, the refugee issue is not affecting primarily rich countries, countries in the global north, countries in North America, including the US, countries in Europe, where I live, countries in like Australia or Japan. These are not the most impacted countries. Far from that. 90% of those 80 million find themselves, are displaced in low or middle income countries. And most of the refugees out of those 80 million, 26 million are technically refugees, people who have crossed borders, are actually refugees in the countries next to the country where they come from. Our role, the role of my organization, is to provide, as we call it, protection and assistance. And this work of providing protection, rights, vulnerabilities, and assistance, water, food, health, this type of work is done essentially in the field. We're a very field-based organization. But also we have a more, how can I say, technical mandate, policy or law-based, right-based mandate to be the custodian of international conventions, in particular the 1951 Convention on refugees. And through this more legal institutional mandate, we also provide advice and support on states on their international obligations in respect of refugees. So this is, in a nutshell, the background. Coming now to the theme, to COVID-19. COVID-19 has stopped almost everything in our world, except possibly conflict, climate change, and other factors that cause the forced displacement of people. The Secretary General, in respect of conflict, the UN Secretary General Antonio Guterres, who happens to be also my predecessor as High Commissioner for Refugees, made an appeal for a global ceasefire, which unfortunately was not taken up in any significant way. So old conflicts that you all know about, Afghanistan, Somalia, and others have persisted, have continued, and new ones, like was mentioned by President Gutmann in northern Ethiopia, Central African Republic, in Nagorno-Karabakh. This is renewed conflict that had been dormant for some time. All these conflicts have continued to rise even in the last few months. This has meant new displacement, new, how we would define them, international protection need, heightened by the constraints posed by the pandemic. And this has meant new displacement, fresh displacement at a time of pandemic. Now, this is a very important point that I often make. For people in flight, like refugees and displaced, movement is vital. If you cannot move, if you cannot flee, you can often not reach safety, physical safety. But we live in these times of pandemic in which movement has had to be stopped because movement brings the virus to other places or risks bringing the virus to other places. So you see the very big dilemma that we've had to face in recent months, defending the right, the need of refugees to cross borders into states that were very reasonably worried that this movement would contribute to the spread of the pandemic. These two aspects, two sides of the coin of movements have been particularly significant in the last few months. And I have to tell you that there have been many important examples that one can mention. I want to mention one that I often mention also. I was there just a few days ago. I was in Uganda. Uganda is a country, mid-sized country in the middle of Africa, about 40 million people, a poor country. that already hosts 1.5 million refugees. 1.5 million refugees. When governments in Europe almost fell, actually some of them fell in 2015 and 16, the flow of people that put Europe on its knees was 1 million. Uganda has 1.5 million, a country of 40 million people. And Uganda had to face at least a couple of times a situation in which from neighboring Congo, the Democratic Republic of Congo, a part of Congo that is particularly affected by conflict, people started pressing on Ugandan borders to enter. So Uganda came to us and said, what do? We want to let them in according to the principles that we believe in of solidarity, of brotherhood, of sisterhood with other Africans, but we are very worried about the pandemic. So we helped Uganda build isolation wards, increase their testing capacity, all the measures that we all know to try and stem the risk of spreading the pandemic. And Uganda repeatedly, although the borders were closed, like in many other countries, they opened the borders to let these people in. I use this example to say that, of course, this has not happened everywhere, but in many places it has happened, and often this has happened in poorer countries, not in countries that perhaps have more robust ways of controlling their borders, but also, may I say, more inward-looking policies, may I use this word, perhaps selfish policies of looking at their interest first, which is understandable in times of pandemic, but there are examples of even more solidarity by other countries as well. My point here being, especially when I explain what we did in Uganda, that refugee protection is not necessarily in contrast with protecting one's population from other hazards. Health in this case, but you can apply the same reasoning to security, for example. Of course, another big challenge that refugees had to face is the health-related challenges. We were very worried in the beginning that we would face huge outbreaks of the pandemic, especially in those situations in which refugees are in camps. Think of Bangladesh, 1 million, almost 900,000 Rohingya refugees closed or, living in a very crowded situation in very disadvantaged camps. Now, there I must say, thanks also to considerable support that we received from our donors and all the work that my colleagues and colleagues from partner organizations did on the ground. We coined, a slogan, "We stay and we deliver," after March last year, no matter what. Through that, posture that implied considerable sacrifices on the part of humanitarian workers, we managed to avoid the worst, and you can imagine through which means prevention, health responses, and so forth. And I have to say that most states were very good, because in whatever national health response they organized, they included refugees. You may think that also this was dictated by self-interest, because if you leave a large population outside the health measures, the risk that the pandemic comes back, even if it is contained with the national population, was very high. The big challenges now, I would say, are two. One is still on the health front, is to ensure that refugees, displaced people, stateless people, which is another category of importance to us, are included in national vaccination campaigns. In theory, the policy in most states is to include them. In practice, it will be very challenging in some countries, because often these populations are in very remote areas. And with the logistics of vaccination, this is a challenge that we are trying to tackle with these states. But what is really going to be, in my opinion, the most lasting impact of the COVID pandemic, even when it's over, on these population on the move, is on the social and economic side. economic side, because you understand very well that people on the move depend essentially on the type of informal economy that is the first one to disappear when lockdowns are established. If you think of the more than 4 million, almost 5 million Venezuelans in Latin America, many of them, I've visited those countries many times, hosted by a variety of countries where even people with qualifications have been obliged to resort to selling fruit in the market or really going for menial and precarious daily wage-based jobs. Most of it has collapsed in lockdowns, and therefore the poverty level of refugees and displaced has risen exponentially. In Lebanon, for example, we talk about Lebanon much these days because of its crisis, but because also it's the 10th anniversary of the Syria war. In Lebanon, we estimated that already a very high percentage of the almost 1 million Syrian refugees lived below extreme poverty level, about half. That proportion has risen to almost 90%. This is very frightening because Lebanon itself, in part because of the same reasons, has also seen a growth of poverty in its own population. So the host communities as well are impoverished. This will be the most significant impact of COVID, but also dropouts from school. There's been a lot of dropouts among vulnerable population when schools closed and then reopened. Less kids went back to school after the reopening. Many of them had to go and work. This is particularly significant in refugee communities, and it is particularly significant with refugee girls. And some studies that we have conducted indicate that up to 50% of the refugee girls that used to go to school before the pandemic will not go back to school when school reopened. And this is extremely dangerous because you know what that means. It means more early marriage forced on these girls. It means exploitation. It means setbacks from gains that we had made in the past few years in all these domains. And in fact, in general, we have seen, and you have heard this for sure in other contexts, we have seen an increase in all these severe problems that affect disadvantaged women in this context. Increased gender and gender-based violence, domestic violence, survival sex, early marriage, and so forth. Of course, UNHCR is reacting to that, is responding to that. We have doubled almost our cash distribution programs. More importantly, perhaps, we're linking up with big financial institutions, the World Bank, for example, the International Monetary Fund, that are helping states design economic rescue packages in post-COVID situations or in COVID situations. And we are advocating for refugees and displaced to be included in those more sustainable rescue packages. I want to conclude, and I've spoken probably already far too long. I want to conclude with just a few, you can call them lessons learned, but I'd like to call them more reminders. What has all this taught us? What is the message of this situation that we had to face in the last year? The first lesson, the first reminder is very obvious. Prevention is key. And these reminders are not just about thinking of the next pandemic, but thinking of other threats and other risks that surround this very fragile situation of forced displacement. So the first one is prevention. Prevention not only in respect of the next pandemic, but prevention precisely in respect, for example, of what climate change, the climate emergency may do to populations in terms of displacement, prevention of conflicts that require better international systems than they are currently. The second one, the second reminder, I have 5, closely related, is better preparedness. We have developed, for example, in the context of the climate emergency, a system that we call predictive analytics. analyzing the dynamics of communities to detect in advance signals that they may be about to be displaced, to move, to migrate. This is very interesting, I think, given the interest in addressing the root causes of forced migration, be it economic or that of refugees and displaced. I can speak more about that later. The third reminder is that I think that the pandemic has brought to the fore something that is relevant in so many areas. We must combat more effectively stigma. And in the case of refugees in particular, this stigma has been double often in times of pandemic, because the stigma attached to the pandemic is one. We have colleagues that I'm not ashamed to say, but anguish to say, even colleagues of ours among national staff, for example, that have kept hidden when they suspected to have COVID because of the stigma attached to it and the fear to be marginalized if this was declared. And this has been translated many times in these poor communities with delayed care and often fatal consequences. So combating stigma is very important, because the other stigma that refugees often carry with themselves is the stigma of being refugees, of being foreigners in countries where they were rejected. So this is a big discussion, of course, in your country. Black Lives Matter, the current big debate on discrimination or stigma attached to people of Asian origin. So I think that lessons that we have learned through the pandemic apply to that as well. The fourth reminder is that, and it's actually the opposite of that, is that inclusion is key. For a long time, we have dealt with refugee crisis in a separate box. Let's build schools for refugees. Let's build hospitals for refugees. Now, we have already learned before the pandemic, but it has become key during the pandemic, that the response is really to convince states to include refugees in their education system, in their health systems, in their economic dynamics. And of course, respond to that not just through humanitarian assistance, which is limited and not sustainable, but through assistance to the health, education, economic system of that country that bigger institutions like the World Bank and others can provide. And this is extremely relevant, of course, in the context of COVID, that has somehow proven that point in a dramatic fashion. And the fifth and last point, last reminder that I want to share with you is the importance of multilateralism. I was speaking to President Gutmann and other organizers earlier, and saying that I'm very happy to be speaking to you today at this particular juncture of the United States history, in which multilateralism finally is back as a positive value. Multilateralism means that, these global challenges that we are talking about, the pandemic is one, but climate change is another, global forced migration is another, and the list is long, can only be tackled together. The myth of my country first, you've gone through this for some time, the myth of my country first, I think, has proven its extreme weakness. I'm in Europe. We are in a deep crisis in respect of vaccines, and part of that crisis is due to a vaccine nationalism that is the child of my country first. And it is now proving catastrophic for an entire continent. So that proves the point that I think can be applied to many other global situations. I will stop here because I think I have vastly exceeded my time, but thank you again for the opportunity and looking forward to questions and debate. Thank you very much.
Thank you, Your Excellency. You just make my job easier. It's shorter. And so here's what I'd like to do. I want to open with this question, and it's sort of your last point, and that's vaccine nationalism. I think we all know that we are not safe until all of us are safe. You understand that with vaccines. So let me ask it this way. Are there particular countries that are examples of how you do this, that you must vaccinate refugees because we are not safe until all of us are safe? Are there good examples of countries that understand that concept?
Yeah, I think actually it is very interesting what you're saying, Deborah, because we have been scrutinizing carefully the vaccination policies of every country that hosts refugees, of course, or that has a displacement situation. And practically all of them have now decided to include them. So I think that it is very interesting, isn't it? Because they are not doing the same for other things, for education, for health, for the economy, all the things I've mentioned. Why? Because I think that the pandemic proves the point more cogently, more urgently that this is necessary. Because of course, if they vaccinate 90% of the population and 10% is not, then they will catch some variants that will come back and infect everybody else. Now, there are 2 points here to be said. One is there are still huge challenges to vaccinate those that are in remote areas. This is really my main appeal. Let's be aware that in many countries, the most vulnerable will be excluded, not because of unwillingness, but because there are no resources or it's very difficult, and that's what we're working out. The other thing that I think is important is that, I was last week in Kenya and Uganda, 2 countries that are great. Both of them told me even before asking, of course we'll vaccinate. Kenya has 500,000, Uganda 1.5 million. And then they said, but, by the way, we haven't got vaccines yet. So not just for the refugees, but I hope everybody realizes that, you are in a country that has done well in vaccination terms. I'm sure that Europe will catch up. The global north will eventually, and in not so long a time, all be vaccinated. There are countries where the first vaccines have just arrived, that only a few thousand people have been vaccinated. This vaccine inequality which is often the result of vaccine nationalism, is an equal scourge. Because if you apply this discourse to one country, that you have to vaccinate all eventually in order for nobody anymore to be affected by COVID, this applies also to the world. If we don't ensure that everybody goes through this at a reasonably equal pace, we run risk, all of us. So this is the real issue here.
So now I want to move to the United States. The Biden administration has pretty much, we're talking black and white. So in this administration, they're talking about 125,000 refugees coming. Have the Americans begun to send teams out into the world to interview people, or is that a way off? And is that the sign that that the United States is back in the refugee business?
First, thanks for this question, because it allows me to say how happy I am of that decision to restore what we called, I think in America, this is usually called the Refugee Admission Program. We call it resettlement. What does it mean? It means taking refugees, especially vulnerable refugees, from one country where they are already refugees, say Kenya or Lebanon or Malaysia, and moving them to a country where they can get better care, better protection, better opportunities. So it's a very valuable program that, when I spoke about 80 million people, you realize even 125,000 is very small, but because it is targeted at the most vulnerable, it is extremely important. During the Trump administration, this figure had declined year after year, down to, I think, about 15,000. I think the Biden administration would like to go to about 60,000 this year and then double this figure next year. The problem, you ask a very important question, are they out there interviewing? They have, the priority now is to rebuild the whole infrastructure that is needed for this program, which has been completely dismantled in the past few years. So I think the administration wisely is going gradually into this. And by the way, this applies to my organization as well, because those interviews, those selections, we do them together. It's a process, it's a joint process between UNHCR and the US government and many other governments. But let me tell you, I am very confident that we'll get there. I hope we can get there in 2 years, but we will get there. Last night, as I told you earlier, I spoke to Secretary Blinken, who himself raised this issue and said it is a priority for the US administration. And I was very encouraged, reassured to hear him say also, and it is a priority for me personally. And I think that this is the feeling of many Americans, and it is very important.
So let me just ask one tiny follow-up on this, and that is, in the presidential determination, they are talking about experimenting with private resettlement in the way that the Canadians do it. Do you see that maybe we get more than 125,000 in fiscal year 2022? Because it's apparently an addition and not within that number.
You're asking me challenging question because, you know, you also, I don't want to sound minimalist. I always say yes when they offer me more. The question is, you also have to do it well, because resettlement is a delicate operation. Because imagine if you resettle badly and people then find themselves in a situation in which they cannot integrate and etc. So I think that all of this needs to move surely but gradually upwards. I am a big fan of private sponsorships. In Canada, we've done a lot of work for years. Canada is a big champion of good resettlement. And this is now spreading to Europe as well. But why is it good? Because private sponsorships are also a way to sensitize public opinion and communities about who refugees are. You know how much is spoken about refugees, how much is said about refugees. Most people that think that refugees are a threat, and this is statistical, are people that have never seen one refugee in their lives. So the fact that now private organizations may be more involved in these sponsorships, I think is also a way to help communities understand better, not only those that are already favorable, but also those that may be suspicious or fearful of these people.
I'd like to turn to your role on the Mexican border. This is new for UNHCR, and I always wondered why you weren't there before. But could you imagine that you become in Mexico doing the same job that you do in Turkey and Lebanon and Jordan, that you are the organization that does those first interviews?
Well, let me slightly correct. It is not true that we are new. We've worked in Mexico for decades, actually.
Yes, you're right. You're right.
Helping Mexico build its own asylum system, because Mexico is also a country of asylum. And it may be the case, because if I understand correctly, the policy of this administration in respect of this enormously complex issue of movements from Central America is the correct one, is to work at all levels, at all, imagine these routes as being exactly routes, like a long strip, right? You have to work at every point of that route, of that road. You have to work on root causes. Why are people leaving? So that's poverty, that's climate, that's violence, that's conflict. Then you have to work at the receiving end. The US has a big job to do in building an effective and humane asylum system. I'm using the words of the administration. This is something we've been saying for a long time, frankly, not just to the previous administration, but also to the ones before. This big backlog of asylum seekers, etc., needs to be reduced, and the system there needs to be investment in the system to make it work better. And then, of course, you have to work on everything in between the countries of origin and the arrival in the US, strengthening the system of transit countries, including Mexico, to manage these flows by themselves. Many people may not want to continue if they have opportunities on the way. I was in Mexico when we could still travel happily in 2019, last time, and I visited in central Mexico in a city called Saltillo, incredible projects run by private organizations to give employment to people coming from the north part of Central America. You know, the countries that are so much talked about these days in the US, Guatemala, Honduras, Salvador. And many of these people whom I met, many, you know, hundreds literally, told me, you know, we were planning to go to the US, but you know, the opportunities here are great. We speak the language, integration is easier. Now, this is not going to be valid for all. Some people have links in the United States, they prefer to go there. And this is why we're saying it's important to keep the US asylum system, to make it again strong and effective, because we cannot only do one part of one segment of that road. We have to work on the whole road, and the US has to maintain an asylum system able to also receive people that arrive directly in the United States. So not just resettle people or people coming through a secondary movement. So that's very important. So this is the most important thing I have to say. All segments, and we, UNHCR, are happy to continue to support initiatives by those countries and by the United States at every step of that road.
I think what I'm talking about in terms of new is, I understand that you all are working with the United States to unravel the Remain in Mexico project. But I guess what I find interesting about this is there a moment when Central Americans have a determination of being refugees rather than asylum seekers? I mean, by all accounts, they are refugees.
Well, I would say that some certainly are. And I think this determination, if that determination is done in the United States because they seek asylum there, has to be done by the United States government. We will certainly advise in many cases, if we're asked for that advice or express opinions, you know, that's our job. I explained it earlier, technical assistance to governments in matters of asylum. We certainly believe that people that flee that are proven as having fled from situation of violence, including sometimes community and almost domestically based violence, need to be considered refugees because they have lost the protection of their country and are seeking protection in another country. So, you know, we are, our view on definitions in respect of people from Central America is pretty broad. That doesn't mean that all of them are refugees. This is why there needs to be a determination process that needs to become, by the way, in the United States, more rapid and efficient and humane.
I note that one of the things that has not stopped during a pandemic are deportation flights from here. There are still Haitians being sent back, and there are still people who are not allowed into the United States because of the pandemic rule put out by the CDC, Rule 42. And I wondered if you thought that was, if there was an end to that.
Deborah, as you imagine, our advice is that Title 42, I think that's the name. Forgive my
title. I think that's correct. Yeah, 42. It's
Title
the one that
42.
says you can't cross the border because of COVID.
Yeah, it's the health-related issue. Should be revisited. And I have spoken about this in my presentation. There are ways to deal with that. Quarantines, isolation wards, testing, you know, there are many ways by now. We have developed ways. I do appreciate that given the, may I say, parlous state of the US asylum system, but not only of the legal system, also of the reception capacity. And this really suffered big setbacks during the past few years, needs to be put back into place. These things, these improvements, this more generosity in receiving people has to be implemented gradually. There, I hear what the administration is saying, and I think that we may have to have an interim period where not everybody can have access, because those structures need to be restored and re-strengthened, if you wish. Meanwhile, of course, it may mean that more people are stuck along the way. So we will have to find ways with those countries how we can handle this particular phenomenon. I think we will see a period of transition, just like for resettlement, which is justified by the circumstances. But yes, the ultimate goal should be not to have a pandemic, a COVID-related blockage, because there are other ways to deal with that particular aspect.
I'm going to now turn to questions from the audience, and there's lots of them. Let me start with Wendy Chan, who asks, can you elaborate on private partnership? The 9 resettlement agencies are already working with community to support integration, getting churches to embrace refugee family and integrate. How exactly will the private partnership be different?
If I understand correctly, and forgive me because I may not be familiar with the details of the American system, is that it's the current resettlement agencies that, by the way, are doing phenomenal work, because they are really the ones launching refugees into the integration process. And I'm so happy that they will be able to restore their programs now that resettlement resumes. This is one aspect of the resettlement. The other aspect, which is more linked to sponsorship, is that private organizations will be involved in the selection of the people that are then brought into the United States for resettlement. So it's a more comprehensive partnership that we and the United States government would have with this particular organization. It's not a simple one because, you know, resettlement, and not just in the United States, and very understandably, is subjected to security scrutiny. It has to be like this. It is very, very important. And therefore, you know, even if the initiators of a certain resettlement program is not the government anymore, but a private organization, those checks will have to be implemented. That's very, very clear. But in Canada, you know, private organizations with our support have managed to develop very efficient systems. And I hope that the United States can follow.
Thank you. And this one, let's see. Although this is a tough one to read, but I will try my best. Given that inward-facing policy may influence reluctance to accept refugees more than capacity, how might we incentivize states to forego domestic xenophobia?
This is a tough one because no, the question is straightforward and very legitimate. Yep. But you know, this is more than forego, perhaps, because this is not like a measure, is how can we help states, can I say, how can we help ourselves, all of us, counter xenophobia? You know, this is not just in the United States. Believe me, I am Italian, a country that in the past was not particularly well known for its hostility to migration, a country that has produced millions of migrants, including to your country. So a country that comes from a tradition of migration. And in the past 20 years, the politicization of migration in Italy has been phenomenal, to the point that now there is real hostility on the part of the public opinion. I think that there are some things, a few things that can be done, because, you know, the campaigns of manipulation of migration, which are essentially vote getters. You know, there's no other reasons for that. They are vote getters. We've seen it. You've seen it big time. We've seen it in Europe a lot here. Those campaigns are so easy to, it's very easy for those campaigns to catch followers because they use very facile arguments. People come, they will steal your jobs, they will threaten your security, and they will undermine your values. This is the trio of reasons that are always, they're all wrong, because it is not true. It may be true in isolated instances, but most overwhelmingly, you know, refugees in particular, not even migrants, refugees that are fleeing from war, from conflict, from persecution, are the ones that are most eager to do well and to be well integrated and not to threaten societies. So, you know, how do you reverse that facile narrative? I think that one means is what I just mentioned, more involvement of civil society, of communities in responding to refugees. We will never be able to convert the extremely hostile. But there is a large slice of the population in the middle who is a little bit on the fence, not sure, etc. So, telling them stories, showing what refugees can achieve. COVID was phenomenal for that. I didn't say it. In Europe, at least, I'm a bit, I haven't been in the US for 1 year, believe me. So I've lost touch a little bit. But in Europe, for example, there was an enormous need for health workers during COVID because of the type of staff-intensive care that COVID demands. And of course, migrants and refugees contributed, people with expertise, and we facilitated that. That projected a very positive image because they were there on the front line doing dangerous work in those isolation wards. So this is the type of things that we have to narrate, if you wish, more, tell stories, give examples, give a voice to these refugees that they tell their story. I think this is very important. There's many other ways we do it. And can I also say one other thing that is more related to governments? I have observed in Europe that even moderate governments, which normally would not have migration hostile policies, are now not only prudent, but very worried of doing anything that smacks of being pro-refugees and pro-migrants because they're worried about the reaction of those that manipulate. So I think that we must encourage these governments to do the right thing. We must tell them, don't be only afraid of the naysayers, of the haters. Listen to a lot of other people in society that continue to have a lot of solidarity towards refugees. And I think that this is important. And let's reward when they make good decisions, reward these governments. I always tell, you've just had an election, so it doesn't apply to you. But when I go to European countries and I speak to young people, they say, what can we do? I say, what you can do in respect of these big global problems, climate change, equality, poverty, refugees and migrants, is reward governments that have good policies by voting for them. This is very important as well.
So, but in the United States, 79% of people who've been polled say they're for it. And no one said, when the Biden administration announced 125,000 refugees, no one said, oh my God, that's too many after these 4 years. They didn't. The numbers stayed pretty much the same. So dig into those numbers. They don't always reflect the wider perception, certainly not here. Let me ask you a question from Michael DeVito. And a lot of people asked about this, and it's the R2P question. As a result of the pandemic, do you believe that a country's sovereignty is taking precedent over their responsibility to protect? And there's about 3 questions on R2P.
Wow, that's a difficult one. And I have to tell you that, just a few blocks down the road here in Geneva sits my colleague, the United Nations High Commissioner for Human Rights. She's much more challenged by this. It's more her job to deal with this than mine. And I don't envy her for that. Because I have to tell you that, unfortunately, the question of sovereignty it continues to be extremely prevalent in international debates. It is very difficult to make an argument that can be perceived as undermining sovereignty. We, heads of United Nations organizations, therefore representing state, or we're not an NGO, we are an organization of states, are constantly reminded that sovereignty cannot be undermined. Now, the question is, there are 2 questions here, in my opinion. One is that we need to then make the point that in tackling this global phenomena, we need to somehow forego sovereignty to, or part of it, to work together. Working together always means a little bit of loss of sovereignty. There's a lot of talk in Europe, this applies less to North America, about what to do with the people that are arriving by sea across the Mediterranean. The Mediterranean, you know, is Europe's equivalent of the Mexican border. So, but except that the Mexican border has only the United States on the other side. The Mediterranean has 27 EU countries and many other countries. And there is a lot of talk about, you know, foregoing sovereignty in the sense that sovereignty would say it's the country where they arrive, it's their problem. It's not the problem of the next country. So what Europe is saying is, let's share this. Let's have a distribution mechanism. Let's forego a little bit of sovereignty, and all of us, we accept as if we were the frontline country. It's a lot of resistance, but a little bit of progress is made there. The more difficult one is the R2P dimension of perceiving as violating sovereignty, intervening inside the country when there are severe violations of human rights. I have to tell you, I'll be very honest with you. This is an important debate that needs to remain alive, but it is a debate around which I am not very optimistic there will be a lot of progress.
Fair enough. This one from Fernando Changwai. Just as UNHCR supports Lebanon with Syrians or Kenyans with Ethiopians for resettlement purposes, are there conversations between UNHCR, Mexico, and the US to advocate with Mexico as a location where Hondurans, Guatemalans, and Salvadorans to be resettled, resettled rather than the US or Canada? I think that you talked about this in a village, in a town that has offered employment, but is there a larger project to be discussed where Mexico becomes the place where people stop?
Yeah. Okay, now I understand. Sorry. Yes, yes. Yeah, no, exactly. I think the reply is yes. Not so much. Sorry, I don't mean to sound too technical. I think what we need to do, what we are doing big time actually, is to help Mexico strengthen its own capacity to receive and even integrate people. Yes, by all means. And we are investing quite a lot of resources in that work. In my last visit to Mexico, I went to this place, Saltillo, and I had very interesting discussion. This was a more difficult discussion in the past. It's easier to have this discussion with the government now. And so, yes, the reply is yes. This is not resettlement. You know, resettlement would be that we transport ourselves, refugees from one country into Mexico. This is premature, of course. Mexico is not a resettlement country. Mexico is already becoming a country, a receiving country of refugees. Forgive me if I'm a little bit, you know, there is a difference between people arriving spontaneously in a country and people being resettled. The United States has both. Most European countries have both. Mexico only has the direct arrival of refugees, but that needs to be strengthened because there's many weaknesses in that system that are important to build. And this is also important for the United States, because if people, rather than moving on towards the US, which by the way means crossing very dangerous areas in northern Mexico, can stop and be, you know, included, maybe not integrated, because maybe eventually they can go back home, but at least be received and treated well and have opportunities in areas of Mexico. Certainly for us, this is important. And we're working with the Mexicans with US support and other countries' support.
Jim Victor takes us to another part of the world, and that is there any light at the end of the tunnel in Syria? Has Assad even given lip service to the idea of resettling its citizens?
I don't know about resettling its citizens, but or maybe that means return of the Syrians to Syria.
I think it does mean return, because we've seen tons of statements that say, no, we don't want them back. Thank you.
I am being a bit literal here. I'm sorry. I know what that question means. Look, this is a complex question. Is there light at the end of the tunnel? I'm an optimist, you know, but I'm a bit challenged here. It's been 10 years. The peace process, there is a peace process, or, you know, there are peace talks rather than a peace process. We haven't seen a lot of progress in the past couple of years, very little. This is the key though, because without a peaceful conclusion of this 10-year-old conflict, you cannot talk of anything else, like real return of refugees. You cannot. There are 5.6 million Syrian refugees in the countries surrounding Syria, another million at least between Europe and other countries. And inside Syria, there's more than 6 million people that are refugees inside the country. Now, one thing that has to be said is that the very devastating and acute active conflict that prevailed in Syria in the first few years of the war has largely subsided. Conflict and military instability are prevalent in two or three big pockets in the country. Idlib in the northwest, the northeast, some pockets in the south, but it's much less damaging materially than the conflict that we saw in past years. So that's progress, let's say. That's better for civilians. I don't know if that's progress. It's better than for civilians that live in those areas. But the whole question of, there are many other questions linked to people's rights, people's welfare, access to services. They are slow to be tackled. Part of it is complex. It's a complex discussion with the Syrian administration. Part of it is that there is a bit of a catch-22 there, because what Syria needs now is in material terms. In material terms, I'm not talking about political or human rights, but in material terms, is really a program of reconstruction. Many of its biggest economic centers are razed to the ground. I visit Syria every year. I go to these places, cities like Homs, like Aleppo, not completely destroyed, but large parts of the cities are destroyed. But there will never be a proper development reconstruction program without a peace agreement. So it's a bit of a catch-22. And I believe personally that we need to continue the dialogue with the Syrian government, with also all other stakeholders in this complex conflict that has many external stakeholders, to come to at least the beginning of a proper constitutional process and open the way at the same time for more rehabilitation and reconstruction. The combination of progress in these two areas would certainly encourage some people to return. Not all, but some people to return. Can I just add that this is particularly dramatic because of course, these 5.6 million are living in very precarious situation, especially those in Lebanon that are almost 1 million. Lebanon is in a crisis of its own, partly due to the Syria war, but not only. So these people are, between a rock and a hard place, frankly, and I don't know what their future looks like. I'm very worried about that.
Fair enough. I think we have time for one more question. This is from Matt Harker. Can you please provide some context on vaccine passports? And I think, thank you very much is the end of that question, but I think what he's asking about is, what do refugees do? If you're a Syrian and you're in Idlib, you are not going to get a big stamp in your passport that said you got a vaccine. It's not going to happen.
The problem is not the vaccine passport, that this person doesn't have a passport, full stop. So there is no passport to stamp with the vaccine. I think the problem is more documentation. By the way, this is a good question, a very good question, because actually I gave 5 reminders, right? The 5 reminders that the crisis gave to us as refugee workers. If a 6th one may be just that, the importance of documentation. In some countries, refugees are provided with good documents that identify them, allow them to have access to services, to bank accounts. You think of your life, it's the same needs, to driving licenses, to all the things that are needed for life. And eventually this will be also necessary to get a vaccine stamp, right? So, but in many other countries, this is either not happening because it's logistically complicated or forbidden by those countries. So documentation is key, is part of our core responsibilities. And the pandemic, because of the need to be well identified, to check one day will come to know whether we've been vaccinated or not. It shows once again the importance of documentation, even for these very vulnerable people on the move.
We are just about to the end of our time here. Of course, things have changed because there's been a change of administrations, but the numbers are really small when you think about what the crisis is. So how do you manage every day to come into the office? Because your problem is as big as it was 8 years ago, even, in administrations that are pro-resettlement.
And if resettlement was my biggest problem, I would say what keeps me going, very good colleagues all over the world. We're 17,000. We're not a small organization. And most of them are on very tough front lines. And they have stayed on those tough front lines through this crisis. And very good partners, NGOs in particular, other UN agencies that we work with. Many American NGOs are our close partners, like IRC, like CARE and CRS and World Vision and many others. And the support that we get from governments, also from the private sector increasingly, but governments in particular, they are the largest share of our financial support comes from government. The US last year gave us $2 billion out of $5 billion mobilized by my organization. It's by in a long way the largest donor to UNHCR. And this has been a bipartisan attitude of the government, which must be recognized and appreciated. And in the end, may I say, it's the support of people like you that follow what we do, that encourage us, that ask us difficult questions. But it is also, and perhaps foremost, the example of those people that are refugees and displaced and they're stateless, and they're stateless. Their resilience, their strength is unbelievable. I always say that it takes so much courage to make that difficult decision to go in exile. I think that President Biden, if I'm not mistaken, said almost the same yesterday in his press conference. Boy, what a difficult decision it is to leave behind all that is familiar to us. It is that strength that inspires us most.
And I'm just looking at the questions, and there is one here from Colombia. Colombia recently granted legal status to 1.7 million Venezuelan migrants. I mean, are you championing that decision? Are you pointing it out to other countries?
Totally championed that decision. I was standing next to President Duque, as probably the person who asked the question knows, when he announced this just a month ago. It was a great moment, one of the highlights of my 5 years in this job, that this would be done. Temporary protection is not asylum, is not like being a refugee, but in the context of Colombia, allows 1.7 million Venezuelans to have access to schools, to health service, to the vaccination, to jobs. It is phenomenal. And it is a big win for the government as well. This is what I really liked about the Colombia decision. The government said, that way we know where these people are, we can document them. Also from the security point of view, Colombia is a very volatile country, is very, very useful. So I certainly encourage other states in the region to follow Colombia's example. It's good for the Venezuelans, it's good for those countries as well.
I'd like to thank you so much, UN High Commissioner Filippo Grandi. It's been such a pleasure to talk to you. I'm going to turn it back over to Mike Horowitz, and we got a lot out of you, so thank you very much.
Well, thank you so much, High Commissioner, for those insights, and thank you, Deb, for moderating an exceptional conversation, and thanks to our audience for joining us here today and asking such thoughtful questions as well, and especially President Gutmann for doing such a tremendous introduction. These are some of the most critical issues that face our world, and it's an honor to have all of you here discussing them, or I guess here discussing them at Perry Worldhouse. Links to register for our upcoming events are in the chat. A recording of this broadcast will be made available on the Perry Worldhouse YouTube channel. If you want to get more information about Perry Worldhouse events, please sign up for our mailing list. You can follow us on social media, basically everywhere at Perry Worldhouse. For up-to-date information on critical contemporary global affairs and public policy issues. And thank you again, High Commissioner and Deb. It's such a pleasure to meet you, sir, and Deb. It's always a pleasure. I feel like you've really become part of the Perry Worldhouse family over the last couple of years, and we hope to have both of you back again soon, and hopefully in person.